Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So before the development of targeted therapy for EGFR mutant non-small cell lung cancer, the chemotherapy had been the mainstay of treatment for advanced non-small cell lung cancer. Year 2004 heralds the beginning of targeted therapy when the erlotinib, which is a type of EGFR targeting agent, was approved for second-line and beyond settings. At the time of approval, it was unknown fully what were the predictors of response to therapy. In the same year, 2004, there were 3 landmark papers that were published showing that activating mutations in the EGFR gene were predictors of response to EGFR tyrosine kinase inhibitor therapy. Looking at one of the studies, a study from Dr. Lynch and colleagues from Boston, show that the patients who received gefitinib and had response were having mutations in their tumors as seen in the table. And often the response was fast and durable. The past decade has seen significant advances in the field of EGFR mutant non-small cell lung cancer, with 5 agents approved in the first-line setting: erlotinib, gefitinib, afatinib, dacomitinib, and osimertinib. And this is one of my patients who is a 60-year-old female who was found to have advanced non-small cell lung cancer with EGFR mutation in exon 21, LA50R. She was treated with EGFR-TKI therapy. And as you can see in the CT images, the big left lung mass shrank significantly with 2 months of treatment. There are several large randomized clinical trials that compared EGFR-TKI therapy with platinum doublet chemotherapy, and all the trials show that there were improvement in the outcomes with EGFR-TKI therapy compared with chemotherapy in terms of objective response rate, which is tumor shrinkage rate, as well as progression-free survival, called PFS.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.